Let us see another important question. The question is, a 28-year-old man is given a drug during an anaphylactic reaction. Shortly after administration, he shows that there is an increase in the heart rate, bronchodilation, and increased blood glucose. Which of the following receptors is primarily responsible for these effects? The options are alpha-1, alpha-2, beta-1, beta-2, and muscarinic. So here in the question given, the patient is having anaphylactic reaction, and soon after administration of the drug, which is the drug of choice of anaphylactic reaction, is the epinephrine. So after that, the patient is having increase in the heart rate, bronchodilation, and increase in the blood glucose. Which of the following receptors is primarily responsible for these effects? The answer here is beta-2 receptors. So let us see why we came to this answer. So in anaphylactic reaction, as we know, the drug of choice is epinephrine, and epinephrine has all four receptors: alpha-1, alpha-2, beta-1, and beta-2. So these are the multiple adrenergic receptors. So the bronchodilation is mediated by beta-2 receptors because it acts on bronchial smooth muscle, and blood sugar levels are increased by beta-2 stimulation, which promotes the glycogenolysis, and heart rate, which is actually increased mainly by the beta-1, but beta-2 also contributes because it acts systemically. So the most distinguishing feature in the question is bronchodilation, which is the action of beta-2 receptors. Along with that, the clues given are increase in the blood glucose, which is also done by the beta-2 because it acts systemically and causes glycogenolysis, and increased heart rate, though beta-1 receptors is the main receptor, but beta-2 also contributes. So the answer here is beta-2 receptor. So the incorrect options, alpha-1 receptor, is wrong because it causes vasoconstriction but not bronchodilation. Bronchodilation is caused by beta-2 receptor. Alpha-2 receptor, it decreases the neurotransmitter release, so this is not the answer. Beta-1 receptor, it increases the heart rate and contractility, but bronchodilation is not caused by beta-1 receptor. And muscarinic receptors, these causes bronchoconstriction but not bronchodilation. So beta-2 receptor stimulation causes bronchodilation, smooth muscle relaxation, and increased glucose release. So the key takeaway points are beta-2 causes bronchodilation and blood glucose increase. So let us see the gist of adrenergic receptors. The adrenergic receptors are alpha-1, alpha-2, beta-1, beta-2, and beta-3. So the alpha-1 is located in the pupil, which supplies the radial muscle, and bladder, sphincter, and also vessels. These causes vasoconstriction, mydriasis, that is dilatation of the pupil, and increases the sphincter tone. So one we can remember as crease because it mostly causes constriction. Alpha-2 is presynaptic nerve terminals. It supplies that and decreases the neurotransmitter release. So it decreases the norepinephrine release. Beta-2, beta-1 acts on heart and kidney, mainly on the juxtaglomerular cells, and increases the heart rate, contractility, and renin release. So 1 is for heart. Beta-2, 2 is for 2 lungs. It mainly acts on lungs, uterus, skeletal muscle vessels, and also systemically, which increases the glycogenolysis. So causes bronchodilation, vasodilation, uterine relaxation. Mostly these causes relaxation. Beta-3 is on the bladder and also on the adipose tissue. It causes lipolysis and bladder relaxation. So 3 is for fat burn. So this is the gist of adrenergic receptors. So main point is beta-2 causes bronchodilation and also increases the blood glucose levels, and beta-1 increases the heart rate. And muscarinic receptors, these causes bronchoconstriction, alpha-1 causes vasoconstriction. So these are the important points in this question.